And a few people know me, I like to tell stories, so I'm going to do this kind of like Star Wars. So it's going to be the ALC Alliance. So disclosures, nothing. But also, I want to disclose that if any resemblance between the characters in the story and you guys is purely coincidental. Okay? So, episode 1, the ALC Alliance. So we have Anakin Porrata Skywalker and Obi-Wan Markovic Kenobi, a part of the story. So, a long time ago in a bone marrow transplant galaxy far, far away, the evil Sith Lord DVHD, or Gravis who holds the sea, sent his henchmen T-cell clones to destroy the ALC Alliance in the planet Neo. The Force was working to develop a new weapon to save the BNT galaxy. AALC, the name was. So the story is being set. The Sith Lord DVHD seduced the BNT galaxy into believing that when you do an allotransplant, and when you give the donor immune cells, you develop this graft versus tumor effect. If you do a full allotransplant, otherwise you give the standard high-dose chemotherapy. And also, if you do what we call a mini-allo or reduced allotransplant, with the caveat that by reducing the high-dose chemo, you minimize toxicity, you also develop this graft versus tumor effect because the donor immune cells attack the cancer. But what if the Lord didn't tell you that unfortunately that immune response from the donor is not as specific, because not only you target the tumor, but also you target the host. You develop this graft versus host disease. And it doesn't matter if you do a full allo or you do a mini allo. And the problem that we're having with this is that most of the time in this type of transplant, the reason why the patient die off is not so much of the cancer, it's because of the complications of the graft versus host disease. However, in this BNT galaxy, there was a new hope. A prophecy was foretold to harness the power of the ALC force. And this came to pass because almost more than a decade ago, we published that in patients that undergo an autologous transplant, if they recover their good lymphocytes, or what we call the ALC, around day 15, the survival was much better compared to those who did not. And the beauty about this is we're using patients' own immune system, so we don't have to worry about rejection or graft versus host disease. So this news in the BNT galaxy spread around, because not only we identify that in T-cell lymphomas, we also published that in B-cell lymphomas, Hodgkin's lymphoma, systemic amyloidosis, and also multiple myeloma. So the idea about this, if we understand this better, not only we can apply this in lymphoma to what I do, but also we can spread this to other malignancies with that. So this story in the galaxy went away in the fact that reached the ears of Yoda Master Thomas Witzig. So he said, to harness the ALC force, we must do. Now, if you remember Star Wars movie, usually Yoda finished with a verb. I think it sounds kind of strong. Like you can say, Dr. Bergstaller, the apheresis machine is not working. You can say, no working, the apheresis machine is. So it sounds a little more catchy with that. So then the question was, where in the autologous setting are these lymphocytes coming from? Because we want to make sure that they recover after transplant so that we improve survival. In the allo setting, we know it's come from the donor, because you can check something called mixed chimerism. But in the autologous setting, we didn't have any idea. So we decided to look back to see where are these lymphocytes coming from. So we look at two possible sources. One is the patient. And the reason that we say that is because even though you get the high-dose chemo, most likely there's been some case report that there's host stem cells that do recover. But take a lot of time for the counts to come back. So most likely these host stem cells do not affect the ALC around day 15. Probably also, there might be some host lymphocyte that survive the high-dose chemo. And we know that because in the allotransplant you develop chimerisms with that. However, in the autologous setting, we don't have a specific method to try to target or ID these host lymphocytes. So if the host is not the main source, then the question is, where else are these coming from? So we decided to look at what you guys do, what you collect. Because not only you collect CD34, which the reason to do that is so the patient recover the white cells and the platelets and the red cells. But we also collect lymphocytes. And the question was, is day 15 ALC coming from this, or is day 15 ALC coming from this? Because if it's coming from this, you say, oh, wait a minute. Now we can manipulate something to collect more of these good lymphocytes to affect ALC recovery and affect survival. And the beauty about this, again, because we're using patients' own immune system, you don't have to worry about graft-versus-host disease. You don't have to worry about post-transplant immunosuppressive therapy like methotrexate or prednisone that we do in the allo. So you minimize toxicity and hopefully improve survival. So what we went ahead and did, retrospectively, we went ahead and looked at the amount of lymphocytes that we collect at the same time that we collect stem cells. And we call those AALC, or autograph absolute lymphocyte count. Any questions so far? Okay. And what we found, that if you collect in the autograph at AALC of 0.5, that's where the number came from the practice change. Regardless, you talk about lymphoma or multiple myeloma, and you infuse those lymphocytes, the survival was better compared to those who did not collect enough of those good lymphocytes. So this news traveled around in the galaxy, and this is another group from Australia, and they look in multiple myeloma, and they found the same thing, but here they did a little more detail than what we did. And they look at different cutoff of the lymphocytes in the autograph. And they found that if you collect 0.3 or above, your recovery was still very good, and that affected survival. See that? So the question then came about is how we can collect now those lymphocytes, besides collecting the stem cells. Because now we can show, at least retrospectively, that we can improve survival. So one thing that we then decided to do is to look at the machines that we use to collect stem cells. If there's any way that we also can manipulate the machine to collect more lymphocytes. Not only to target the hemoglobin, the white count, the platelet count, but also to target the lymphocyte recovery and survival. So Rajini Kathipamula, I don't know if you remember her or not, she did a study when she went back and she looked at patients that collected with these aspirator machines at the same time. Because sometimes some patients collected with the Spectra, sometimes with the Amicus or so forth. But we asked her to look at patients that collected with the same machine every time. And interesting, she found that people that collected with the Spectra, the survival was better compared to the Amicus and the Finger. However, when she presented this to the apheresis community, obviously the Spectra people was very happy. But the question was really the machine doing the business? Or more important is what the machine is collecting that is affecting the survival? So when we look deeper, we look at the amount of pre-collection ALC, and it was pretty much even throughout. We look at the CD34 target, and it was even throughout. Very interesting, even though the parameters for each machine was to target this, we found kind of by serendipity that the Spectra collected more AALC. If you want to do whatever metric per liter, per kilogram, and so forth, and because of that higher collection, that translated to a better day 15 ALC, translated to a better survival. So obviously, the fifth law was not very happy. So we wanted to destroy the machines. So the Fengwa and the Spectra were a little bit obsolete, but the Alliance didn't give up. So they went ahead and saved the Amicus. But we needed to do something to the Amicus. We need to do something to manipulate the Amicus to collect more of these lymphocytes. So the Alliance went to Planet Mayo, and in the town of Eisenberg, they found a Master Jada Beck scholar. Sounds very galactic, isn't it? So with Master Jada Beck scholar, we did a study. where he was able to manipulate the apheresis machine, specifically the amicus, to try not only to collect enough stem cells, but also to collect more of these good lymphocytes with that. And because of that manipulation, the Alliance, a phase 3 double-blind randomized study. And the purpose of this was to randomize patients to the new modified amicus versus the standard amicus. And the main hypothesis here is that we were hoping that by manipulating the machine, we can collect more of these good lymphocytes. And by doing that, affect survival of the patients. The beauty about this randomized study, all that we're doing, is changing the manipulation of the machine. We're not adding any other variables, but you're going to see that was one variable that affected a little bit of the outcomes. And the beauty again, we don't add any new medications, just changing the parameter. And people in this study were able to be mobilized with G or plerixafor with that. So the Alliance went ahead and gathered a few of the Jedi Knights. And we have 62 in the modified, 60 in the standard. And both were balanced in the force, so pretty much make sure there's no other factors with that. A few of those Jedi Knights unfortunately were lost in battle, part of the reason that we're not able to mobilize enough stem cells to go ahead. And I'm going to bring that up because when we did this study, our goal at that time of CD34 was 5, was not 4. And that is an important factor, as I'll show you in a minute. But when we went ahead and compared machine versus machine, okay? So this is the machine versus machine. Not what the machine collected, because that's what we wanted to prove. We didn't see too much of a difference with that. That's the overall survival. The progression-free survival probably a little bit better than modified, but not good enough. So it looks like the Alliance was in peril, and the Sith Lord Litzo said the Alliance is doomed. But there still was hope. A little bit, because then we decided to look not so much at the machine itself, but the purpose of what conveyed the survival is what we collect and give to the patient. So when we look at the AALC that was collected, if your AALC was 0.5, you overall survival at 2 years, that was the time that we wanted to do, it was close to probably 95% versus 70%. And if you look at the progression-free survival, in other words, the chances of being alive without disease, by giving the AALC, we were able to improve that from 50%, probably close to 80%, by using patients' own immune system with that. So then we have a question, because say, but why, if the machine was the purpose to collect more lymphocytes, you assume that the modified, because collected more of this, would show kind of similar curve. What was the problem? So went ahead and we looked at the AALC per group, and regardless if you were in the modified or in the standard, as long as you still collected 0.5, your overall survival and progression-free survival was still better. Okay? So the question was, what other factor would this